Welcome back to News Geelong. A world first, that's what I said, a world first for lake imaging radiological services in our city of Geelong has been introduced, linking the knowledge and skills of German and Geelong medical information technology experts that is leading the way internationally with almost a significant improvement in medical imaging technology that will vastly improve the communication of much needed health service information for doctors, patients and families. News Geelong spoke with John Livingston, Director of Lake Imaging, about this wonderful development.
I guess put it into very simple terms, of the benefits, if I use orthopaedics for one, is that it allows us, through the distribution of these images, being very what I call thin client, which is basically means it doesn't need a lot of telecommunication bandwidth to be able to transmit those images through. A study can be anything from 60 or 70 megabytes up to a gigabyte in size, which is a lot of data to be shifting around. What this system does is, if your child or a family member, or even yourself for that matter, has the unfortunate event of falling over and breaking an arm, they go to see their GP and say, listen, I need an x-ray, goes to Lake Imaging, they have the x-ray, comes back to the GP, he can then look at these images on the screen and then decide in consultation with a specialist such as an orthopaedic surgeon whether that person needs to be managed by the GP or it needs to be operated on. So the best example of that is that the images that sit on the GP's desktop, he rings an orthopaedic surgeon who may be operating at the time. They look at the images and say, listen, that's a nasty fracture. That patient needs to come into emergency and then I'll operate on them this evening. Or they might say, listen, that's okay, put it in a back slab or a plaster, I'll see them in a week's time. So it increases the service and the, I guess, the ultimate flexibility of patients being able to get in and be managed in a timely manner without having to physically trape around with films or CDs that historically we've had to endure. What we've got here up in this screen here is the ability to move through what's called cross-sectional imaging. This is like slicing a loaf of bread up into various slices, and you can see the body end on. This particular segment up here is just basically looking at the body in what's called a coronal plane, which is from front to back, and this last one also looks at it in a cross-sectional plane, being a sagittal. So what we've got here is the ability to put all that together and rotate through and see the heart. We can see the sternum sitting at the front there, the aorta, which is a major blood vessel in the body that comes into the top of the heart. And through various ways of editing this, we can see the coronary vessels as they come down through the side of the heart and give us the ability to easily diagnose coronary artery disease, which is basically assessed by a blockage of a vessel.
Thank you, John. It certainly continues to make us proud to see such significant medical developments evolve in our great city of Geelong. We will never forget the horrifying bushfires of 1969 out at Lara, the Ash Wednesday bushfires of 1983, and last year, Black Saturday fires, all that have seen horrific loss of human lives and overwhelming property devastation. Locally, we continue to be ever so aware of bushfire dangers, and the people of Lara are an excellent example of this due diligence, as Weirzbowski reports.
It's been 40 years since deadly rapid fires spread from Bacchus Marsh Road to Corio Bay, killing 19 people in just over an hour. But the threat of a repeat is still fresh in the minds of local firefighters.
Up until obviously the events of last year, February 7th, was one of the worst fires that's hit Victoria. The fire started out in the Bacchus Marsh Road area, out to the sort of northwest of Lara, and burnt through right through the main part of the township of Lara, and then only really stopped at Corio Bay, which is where it stopped by the water basically. So and there was I think 19 people from memory killed. Most of them were out in the Princess Freeway, where they were trapped either in their vehicles or trying to run away from the fire. So it was a pretty bad time in the Lara area, but it certainly made Lara very conscious of fire and things like that.
Fire fears, just like here in Lara, are present all over Victoria, prompting the state government to take essential action in limiting damage as well as loss of life. Some of the new steps include SMS warnings sent to mobile phones through a new national emergency warning system. There is also a standard emergency warning signal capable of interrupting media broadcasts, and additional resources have been deployed to fire preparation and firefighting efforts. Homes all over Victoria have been sent this brochure from the state government, sharing information on the fire season, detailing preparation, action and survival in case of a fire. It also features the new fire danger rating scale with code red signifying deadly blaze threats as catastrophic. Weirzbowski, News Geelong.
A continued and important reminder for us all. The public bus system around Geelong has been the breaking ground for the new Mikey system. We know that our friends in Melbourne have been experiencing some difficulties, but how's it been in Geelong? Well, Erin Pearson reports for us with this up-to-date report.
The Brumby government fueled system, designed to cure Victoria's public transport problems, Mikey, has hit the headlines hard as its introduction into Melbourne has come on quite soon. Coming up to its 12-month introduction into Geelong, Public Transport Users Association Geelong convener Paul Westcott talks to News Geelong about his experiences with Mikey and the consumer feedback he has received.
Well, I'd have to say pretty patchy. We've been on Mikey now down here in Geelong since early March, and Geelong was the guinea pig. It was the test bed for Mikey, because they said if they could get it running on buses, then they could get it running anywhere. Well, unfortunately, to get it running on buses has proved to be very difficult.
And how is everything running now compared to when it was first introduced down here in Geelong?
Well, that's the worrying thing, really. We haven't really noticed a great improvement in the 9 months of trial. So despite the fact that we've been assured by the Transport Ticketing Authority, who are running the show, that various things will be improved, and when we've reported problems, they've said, yes, we'll look at fixing that up and that shouldn't be a problem. It has turned out to be a problem, and I think that's reflected in the fact that they haven't turned it on in buses or trams in Melbourne.
Do you reckon the Mikey system is working well in Geelong?
I don't have a problem with it. Now, if it works with other people, I don't know, but with me, I don't have a problem.
And Chris, as a local bus driver, how are you finding the Mikey systems working for customers?
Pretty good. Yeah, most of the customers are pretty happy about it, and the short-term ticketing system works fine.
Fantastic. Thank you for your time.
Thank you, Erin, and particularly to Bill, the bus driver. Only 1 in 30 Australians are blood donors, but more than 1 in 3 people will need blood sometime during their lifetime. The Red Cross blood donations to continue to save lives. Weirzbowski reports on this vital community program.
Now that the Christmas New Year period is over, the Red Cross Blood Bank desperately needs your blood to help save lives.
I've been doing it since I was about 18, so that's 30 years. Now I donate plasma and platelets. I can do that platelets every fortnight, plasma every month, so I alternate. One fortnight plasma, the other fortnight platelets.
Donations drastically drop over the new year, but the need for blood remains as strong as ever. People can also donate plasma as well as platelets, which are disc-shaped shells within the blood used to treat children with leukemia before having the remaining blood pumped back into the donor.
Well, a lot of our lovely regular donors go away on holiday, and sometimes they're a bit too busy to come and donate, so we need more people to fill in their spots because the need for blood never goes away. If you're a whole blood donor and you have a pretty good track record with giving donations and your health is great, you can try for plasma and platelets. I've been giving plasma, and you can do that every 2 weeks, and platelets you can as well, and both products help cancer patients, burns victims, leukemia victims, all sorts of treatments. Well, Australians are really good folk, and we're very lucky to have so many hundreds and thousands of donors who give to complete strangers. They give their time, they sit in the chair, each blood donation can save 3 lives. So in the lead up to Australia Day, people are still in holiday mode, and we need to have more people to sign up and become blood donors, and it's really a good idea.
The new Geelong Red Cross Blood Bank is located here at 237 Ryrie Street, opposite Geelong Private Hospital. For more information, call 13 14 95 or go to the website at donateblood.com.au. Luke Weirzbowski, News Geelong.
Thanks, Luke. Always knew your blood was worth bottling. As we go to a break on News Geelong, Tim Michell joins us next with highlights in Geelong sport and the world of weather.